Hi, Dr. O. I was a real jock growing up, playing a number of different sports, and I've done manual labor most of my life. So my wrists are something of a minefield these days. The doctor diagnosed me with wrist instability and is suggesting surgery. What are your thoughts on the matter? Doctor?
Well, number one, x-rays and looking at MRIs to determine which ligaments are injured. And as I just told you, a TFCC or a volar radioscaphocapitate ligament, that's the ligament that goes underneath from your radius into your capitate, but it's deep in your wrist. Those two, you can fix at any time and have the same result. But a scapholunate dissociation, that needs to get fixed right away. So the question is, which wrist instability is it? And, does it absolutely need to be fixed? And wrist instability implies a ligament tear, such that now you've got laxity between two bones or someplace in the wrist. And so that's really the question: is which ligament is it, and what should we do? And once again, if it's scapholunate, that does need to be repaired. If it is radioscaphocapitate or TFCC, many times the splint, if you'll be diligent, will get that to improve by 1 to 2 grades of laxity, and therefore you don't need the surgery.